All right, welcome everybody to podcast series on innovative healthcare solutions sponsored by the Conference of Consulting Actuaries, or CCA. This is the first in a series of interviews with actuaries and other professionals focused on delivering innovation in healthcare. I'm sure you'll enjoy this session and all the great discussions we plan to have highlighting the interesting people, products, and services designed to better drive a healthcare system. These sessions are offered to provide insights about what's transpiring in the ever-changing healthcare environment in which we live. While these sessions are not necessarily designed to offer continuing education credit for actuaries or other professionals, each viewer can assess for themselves if it meets the criteria for such credit. My name is Ed Podlosky, and I'm president of Morningstar Actuarial Consulting. I'm also the chair of the CCA's healthcare community, and I'll be your host for today's discussion. I'm delighted to be joined today by Gary Stanford. Gary is Vice President and Actuary at Healthcare Services Corp, and you may recognize HCSC as the entity that operates the Blue Cross Blue Shield plans in Illinois, Montana, New Mexico, Oklahoma, and Texas. Gary is a fellow of the Conference of Consulting Actuaries, a fellow of the Society of Actuaries, and a member of the American Academy of Actuaries. In Gary's 8 years now at HCSC, he's focused on provider contracting, performance measurement, and value-based care, just to name a few areas. He also spent some time prior to that with Aon and Ernst & Young. The latter entity is where Gary and I actually met, although we were in different business units, being both healthcare actuaries. We interacted quite a bit to try to share some insights and help us both. So Gary, thanks for joining us today.
Thank you. I'm really honored to be here, and especially excited to be the first one. So I get to help you guys work out the kinks, and if I make some mistakes along the way, then we'll just chalk that up to getting this down.
Yeah, I'll be interesting. It'll be interesting to find out when that first doorbell rings or dog barks or something like that.
Certainly.
But we'll go through that. Hey Gary, I gave kind of a brief background, but I didn't know if I left anything out or if there was anything that you wanted to share for the benefit of our audience.
Yeah, maybe just, since this is a CCA podcast, you did mention that I've been at HCSC for 8 years. Prior to that, I was in consulting and was a member of the conference back then. But I've maintained that membership even in my tenure at the insurer, just because I feel it's still very valuable. It's a great organization. I think some of the content that's made available, particularly some of the interviews that are done, are excellent. And so I've felt it valuable to maintain that membership. And some of the work that I've done has been, I still interact quite a bit with the consulting firms. So I think that's been super helpful. So yeah, for those of you out there wondering why I'm a member still, or why I'm a member at all, that's why. So I think it's still valuable to maintain that.
I'm really glad to hear that, Gary. We hear that a lot from those actuaries who don't consider themselves quote unquote consultants. We like to think of you all as obviously being consultants to the senior leadership within your own organizations, and then obviously the interaction that you may have with consultants to those that you share clients with can also be beneficial. So thank you for sharing that. Hey, Gary, what really intrigues me about this interview is the uniqueness of your position at HCSC. Can you tell us more about your role and that of your team that you work with at HCSC and what you guys do?
Sure. So I came to HCSC to take on some new challenges that I guess I used to call it non-traditional actuarial work, but I think it's becoming more and more common. So now I tend to say it's more emerging actuarial practice areas. So my focus has been really on the provider and network space. So provider contracting, building networks, measuring provider performance, the performance of our networks in consultant benchmarking tools. That's where some of my relations with consulting firms still continue. Value-based care, and more recently, or very recently, have taken on a role with transparency and the impact that will have on us, as well as making sense of all the data that will be made available and use that to help us be more competitive as well. So, all of this provider network space, it's so, I think, ripe for opportunity, and there are a lot of very interesting and difficult problems to solve. And I think it's sort of a perfect fit for an actuary, even though it's not pricing, it's not reserving, it's not the, quote, normal things that actuaries do at insurance companies, but it's very important work that I think fits our skill set well.
Well, you've always been a trendsetter, so I clearly see the value you can bring in that role. Hey, you mentioned price transparency in healthcare, and obviously there's been a focus on that for quite a long time now. And of course, the federal regulations went into effect at the start of this year for insurers, and so that's somewhat kind of the next step in our progression of getting more insights into how best to use the healthcare system by particularly your plan members. How do you see price transparency affecting health plans and providers down the road?
I think it will be a real game changer. And I say that I kind of hate that term because I think it's overused, but it really is. I mean, initially it's going to be messy. It is super messy. So this year, the hospitals had to start publishing their transparency information. And for the most part, compliance has been terrible. The data's a mess. Sometimes it's complete. Most of the time it's not. It's very, very difficult to use. And then next year, the insurers will be required to share that information as well. Actually, it got deferred to middle of next year, but still, it will happen. And it's going to be rough initially, but over time, you can expect that there will be higher compliance. There will be increasing penalties, probably more standards set, more regulations about how this data has to be prepared and shared. So I think we'll see it being better and better and better. And as that happens, I think it really changes the nature of competition amongst insurers and hospitals. So provider contracts are incredibly complex. Even for those of us who think about and work with those every day, they're difficult to make sense of, much less an average consumer. But as we can start to, I'm sure there will be many companies focused on, starting up to make sense of that information, make some tools available. There will be articles, exposés on some of the variations. There already have been. There was one, I think it was just last week in the New York Times, that referenced some of the most egregious examples they had found in data published thus far. So, but as that continues, you can imagine that the insurer's reaction will be to negotiate better deals. If we find out that a competitor has a better deal with a particular hospital, of course, we're going to try to negotiate a similar deal. Or in most cases, it may not be that one is better than the other, but it may be better for a particular thing and not as good for another thing. So I think there will be more standardization, maybe normalization, that will make some of those comparisons across providers more sensible in the future. So all of that, I think, leads to sort of price unit cost compression. And when you think about the market today, that unit cost is really a big part of how insurers compete with one another. Who has the best networks with the best discounts? That's a typical thing a consulting firm would look at when they're looking to place their ASO business or something. And it certainly drives insured prices as well. So when you take unit cost out of the equation, okay, now what? So I think it will increasingly switch to the patient experience, managing care, looking at the overall value that the plan is bringing versus unit cost. And certainly you would expect unit cost will still be a factor, but maybe not as much of one, and certainly not as obfuscated as it is today. So I think it'll be a really interesting time as this develops over the next several years.
Yeah, I noticed too that, part of your role was looking at value-based care. So how much of that is now going to have an influence, particularly when you're able to, providers are able to see what they're all paying together? Does that become a much bigger and potentially stronger component of discussions that your organization and others will have with providers?
I think it will. I mean, and certainly within value-based care, unit cost differences are a big driver of how successful or not successful some of those organizations are. And as there's more and more transparency, I think it will be easier for, say, an ACO to understand better what the costs are for the, say, the facilities that they use. And if A is higher cost than B, but they have similar outcomes, well, let's use B because that's going to help us be more successful, have a lower cost, a lower trend, and get a larger incentive out of that ACO structure. So I think that will be, it will facilitate a lot of what they are trying to do. Because today, I mean, they want that information today, but a lot of it is insurers are often hamstrung, you know, it's like that they're proprietary deals with providers. You can't share that with other providers. So as much as it would be useful to them to have it, they just can't today. But in the future, I think that will be a much easier thing for them to take advantage of.
You know, Gary, you've presented at the annual meeting of the CCA in the past on both machine learning and artificial intelligence. So you know, maybe help our audience kind of understand how you're using these tools in the work that you're doing around providers, networks, and value-based care.
Yeah, and maybe I'll back up a little bit from that and just talk about why I'm even have an interest, and then how we're using it. So I've always had a bit of a techie background. I actually started off intending to be a computer engineer, and somewhere along the way I realized, you know what, I like using technology more than building it. And eventually found my way into math and actuarial science, and here we are. But that techie background really helped me, honestly, throughout my career. I just had skills, knowledge, ability to do things that weren't, I guess, you know, part of the typical actuarial skill set. And more recently, I would say, you know, I was practicing data science even before data science as a term really existed. But more recently, with the computing power, increases in computing power, the new technologies that have developed, it's just opened up new avenues to apply it. And a lot of the work in the network space, the problems are of a complexity that just make it nearly impossible to use some of the techniques that we were actually trained as actuaries. So we turned to some of these other tools, and where it really came to a head was when we were building a solution to measure provider performance. It's really, really difficult to determine how well a physician practices. They have different patient populations they treat. They specialize in different things. They practice in different areas. There's just a host of variables to consider. And when you put it all together, and I counted it up once, and I don't remember off the top of my head, but it was tens of thousands of variables that we wanted to model on. And that is not your father's regression model. And all of those variables interact in some ways. It's definitely not linear. So it's just, okay, we need some new techniques to do this. And that's, I think, when I really got deep into, okay, what are some of the alternatives? And you get into some of the decision tree models and more advanced flavors of regression. And maybe what a lot of people think of when you hear the term machine learning, you think of neural networks, which are incredibly powerful, also incredibly difficult to explain what they're doing and how they're doing it. But a lot of these techniques can be used to solve some of these more complicated problems where the data is huge, the variables are huge, the interactions are too vast to even contemplate individually. So you need an automated way to do it. And I think that was my particular focus and why I went down that path. But you could really think about any actuarial problem these days and realize the amount of data that we have available to us has vastly expanded. The computational power available to us has vastly expanded and gotten cheaper. A lot of the traditional actuarial models, I think, were very practical. They were the best that could be done with the constraints of the time. But I think we can do a lot better now. And one of my fears is that if we don't, someone else will, and sort of render some of the actuarial work less or more obsolete. So that's been my approach. And I am a practitioner. I use a lot of data science. I also feel strongly that it's something more actuaries need to adopt and develop. And maybe the realistic part of me accepts that it's already really, really difficult to become an actuary. And then if you have to become a data scientist on top of that, it's maybe not realistic to expect that, everybody can sort of master all of those domains. So there will be some element of knowing enough so that we can work with others who are experts in that particular field. Just the same way, we work with attorneys and IT folks and, others. I think that same sort of model will emerge, but we need to have the foundational knowledge to guide it.
Yeah, I think the expertise, the insurance expertise, the skills that you bring in addition to the data science makes you a much more powerful asset to your organization than just probably understanding how to manipulate the data on its own. Having that healthcare background, I'm sure, provides a lot of insights that others don't have. So I would be in 100% agreement with you. Gary, be interesting. You've talked a lot about how you're using machine learning, artificial intelligence, and focusing on your work with providers and value-based care. So, kind of tying this all together, what value do your plan participants and maybe you can even touch on providers kind of receive from the type of work that you do?
Yeah, and that is one thing that I really enjoy about the areas that I focus in is really there's a direct tie to some of the work that I've focused on and providing lower cost products, plans to our members, and helping providers understand the drivers of their performance, things that they can do better, helping the ACOs and other value-based care organizations to be successful, which of course we want. Negotiating better contracts, building better networks, at least in some cases steering, in other cases just providing the knowledge to members of who is likely to treat their condition best, most cost effectively, reduce their out-of-pocket expense. These all have a very positive impact on the membership. And then providers on the other side, they want feedback. They need feedback. It's one thing, and there have been some very frustrating conversations within ACOs where you say, well, your trend was too high and there's no incentive this year. And it's like, well, why? What could we do? How could we improve? And those are very difficult questions to answer. But as we drill down into some of these things, like, well, okay, some of the outside specialists that are used, if you use this specialist versus that specialist, or this facility versus that facility, or, this particular area of utilization is a little out of whack with the norms. So these are things that maybe you can focus on and tighten up your protocols. So those are all things that I think just help the system as a whole work better. So ideally, I guess what I'm trying to do is help the system be more affordable or become less unaffordable. Unfortunately, costs keep going up. We're not going the other direction, right? But maybe someday, but at least we can go up less is what I'm trying to achieve.
Great. Thanks for sharing that with us. Just trying to wrap things up here. I do have one last question for you. If you hadn't decided to choose a career path as an actuary, what would you be doing for a career today?
Honestly, at the point that I switched my major in college, I was really trying to figure that out because, I mentioned I was computer engineering. It's like, okay, this isn't for me. What am I going to do? So my plan B was professor. because I do enjoy teaching, mentoring, helping others learn. And I thought that would have been great. Unfortunately, that's a very long path. And of course, the naive college kid in me thought actuary sounded like something easier, which it turned out very much not to be. But yeah, so a college professor, a math professor in particular, that was one path I considered. The other, I would say my dream job back at that point was a physics PhD, a physics researcher. Let's figure out how the universe works. That sounded like a lot of fun.
Well, that explains your background, but I certainly tell I think you've been a great educator for us here today. So I really appreciate you sharing your time. I'd really like to encourage our viewers who also participate in our healthcare community to continue any discussion about the insights shared here on this platform. If you're not a member of the CCA, you may want to consider joining, not only experience the benefit of the community platforms of the CCA for informal discussions like this, but also some of the other great benefits our members enjoy. Gary, thanks for being here today and sharing your experiences at what you and HCSC are doing to drive innovation in healthcare. I'm sure our audience benefited from the time you spent with us. I know I did. Thanks again.
Thank you. This has been great. And hopefully others out there thinking about how they can use their actuarial skills to innovate and do some new and interesting things. There's tons of opportunity. You just got to go seize it.
Great. Thank you.
Thank you.